welcome to this Forbes Middle East webinar hosted in partnership with GE Healthcare. The healthcare sector has been at the forefront of the COVID-19 pandemic, and it continues to face several layers of challenges as it attempts to improve patient services, offer higher quality care, and achieve earlier diagnosis, thus saving lives, resources, and of course, valuable time. The strain on the healthcare workers globally and the goals set for their staff seem like a never-ending race at a time when almost every single sector is facing its own unique set of challenges. The World Health Organization estimates that 20 to 40% of health systems' resources are currently wasted, undermining services and adding to an already overburdened teams of doctors, nurses, and clinicians. Enter digital tools and smart solutions. From virtual hospitals to remote diagnosis and surgeries, technology today continues to offer practical solutions to healthcare workers, manifesting in the latest discoveries in AI, advanced analytics, and smart data input software, thus solving the industry's productivity challenges by improving access, enabling more precise patient diagnosis and treatment, shortening hospital stays and wait times, and lowering overall costs. GCC nations alone are contributing around 52% of the total healthcare expenditure, investing in digital solutions and innovative tools, serving the industry and patients as a whole. Today in this webinar, we discuss challenges and opportunities facing the healthcare sector in this digital world. I'd like to introduce basically an extensive list of experts on today's panel. I start with welcoming Ahmed Yahya, COO of American Hospital, Dr. Hatem Ghanem, Consultant Radiologist and Medical Director, Unison Capital Investment. I also welcome Mark Stoesz, who's the General Manager, Emerging Markets at GE. Saif Siksik, who's the Business Application and Digital Transformation Director at Saha. Dr. Mazen Gadir, who's the advisor for DHA. Last but not least, of course, Jeff Terry, who's the CEO, GE Clinical Command Center. I welcome all of you, and allow me to quickly start with Mr. Yahya. How has American Hospital harnessed the AI approach to provide timely care for patients, and how have you significantly improved clinical outcomes and focusing on personalized patient care?
Thank you, and good afternoon, everyone. Actually, this is an exciting time to have this kind of discussion. The worldwide, there's been a big change in the fabric of how we do business, of how we handle business. And one core area that has been impacted quite tremendously is healthcare. It changed the fabric of pretty much how countries do business, organizations, and people. And such, you really need to look at a holistic approach of how do you become more agile to handle these kind of, I guess, events. And for American Hospital, we've always been agile, and we're been a data-driven organization for a long time. What that helped us in the last year and a half or 2 years, it took us into a different plateau where it actually sped up our digital transformation journey, and we were able to look at the patient in a holistic approach. The information about the patient is as important, if not the patient himself. And we looked at how do we actually harness that information, and technology becomes a nervous system to the organization, and you start garnering this information and actually coming up with solutions that can impact the outcome of the clinical side of the patient and his experience and the operational side of things. So from our end, it's a combination of technology and people and information architecture that actually had to blend together to help us achieve some of the core efficiencies that we've achieved in the last year and a half, 2 years. On the AI stuff, we've actually worked on developing a COVID AI model that helped us on controlling our intake of our COVID patients into ICU. We worked very closely hand in hand with our clinical folks, our operational folks, our emergency folks to come up with these clinical models that really helped us in smoothing the intake into our ICU. And actually, it helped us quite tremendously using some key critical factors. Also, we've embedded into more of predicting our no-show rates of patients coming in. And we looked at historical data back and forth, and actually the analysis helped us out to know exactly when our no-show rates actually move up in time, and we can do either double bookings or we can reallocate our resources in a more smart way, if you will. Plus, imaging has been is a sweet spot for AI in general in healthcare. We actually worked very closely on the breast solutions to help in analyzing ultrasound images to look at the likelihood of malignancies. And that really helped our physician to actually have better outcomes for our patients. And we have some other models that we're looking at that we move forward in. But again, the core thing is whatever we develop needs to be operationalized and has to be practical. And it's not an IT-driven initiative usually. It has to be both clinical and technology-wise. So we're the cusp of this move, and it's really exciting for us.
Perfect. Data seems to be the new currency, specifically in this sector. Not very far from you. I'm going to take this idea to Dr. Ghanem. If you don't mind telling us, how have you utilized technology and digital solutions to maybe allocate your resources efficiently towards different departments and different needs?
Yeah, good afternoon, everybody. Thank you for the invitation. Actually, if we are talking about the digitizing digitization in healthcare, as well as artificial intelligence, we should consider radiology or imaging as the first part where there is a real impact on what's happening in the field of radiology, completely change the workflow in different modalities and different specialties. Now, being connecting the hospital together, now we can have many hospitals reported centrally by 2 or 3 radiologists, expert, or subspecialty radiology. So we can report any case from anywhere as long as it is linked by what's called radiology information system and picture archiving and communication system. So this is the first step, and I believe that this is happening since more than 20 years. But now the progress in the field of digitization in the healthcare, we found out the application of AI. Let's talk, as previously mentioned, for the field of breast imaging. We apply the artificial intelligence, connecting 10 mammography machines, apply the artificial intelligence. So this machine can get the abnormality within the any breast and mammography within seconds, and depends on the machine learning. As much as information the machine has, so we got the result, which is very, very competing to the expert radiologist, and we have examples of this. So in the field of mammography, artificial intelligence plays very important role in diagnosis and the staging of breast malignancy. In the field of brain stroke in emergency, we have early brain stroke. To detect this in CT within a few minutes before the thrombus or the infarction have been developed, this can be diagnosed within the machine itself. It shows in the emergency department, not waiting for the radiologist to confirm it, especially in the first hours after the stroke. This is very useful in saving or changing the patient prognosis in such cases. We have also artificial intelligence in case of chest X-ray. When we have chest X-ray with, for example, of TB or any other machine, any other abnormality, you can detect it very easily by applying the artificial intelligence. Artificial intelligence also plays a very important role in diagnosis of chest CT diseases, especially for COVID-19. We have very frequent, very huge number of cases which have been diagnosed by the artificial intelligence and CT chest to grade the COVID-19 pathology, starting from grade 1 till grade 5. Also, it is important in calcification of the coronary artery in case of coronary artery disease. Now, apart from the artificial intelligence, to improve the quality of the report, also we apply what's called peer review, which is anonymized cases reported by 2 different radiologists and reviewed by a specialized or consultant radiologist to improve the quality of the report, plus many things related to the research and medical library. I believe the radiology, in the field of radiology, there's the most progress and positive feedback happen in this field.
Yeah, and possibly very life-saving as well. Solutions are emerging. Let me take, thanks for so many practical examples. Let me take these to Mark. We've heard a lot of examples from Dr. Ghanem about how radiology is, and maybe sometimes lowering the time to get that diagnosis out. How do you think technology and the solutions you are offering have the potential to lead long-term improvements when it comes to patient care?
Yeah, actually, sorry, is it me?
Sorry, no, I took everything you told us, Dr. Ghanem, and I'm going to go now a little bit to Mark because he has a little bit of perspective from a tech point of view, and then we're going to continue. Go ahead.
So from GE Healthcare's perspective, I think when we look at where we are today, I think the transformation that's occurred because of COVID pandemic has allowed us to do quite a few unique things that were taking longer to implement. For example, for Professor Hatem, to make sure his systems are, for example, operationally as much uptime as almost 100%, we started to do 40% of our maintenance work can be done preventatively. And by that, I mean, we can, in the background, remotely make sure that he has the latest firmware, the latest software on those platforms so that he can offer the best service possible. Additionally, when we think about places that are further away from maybe major metropolitan areas or non-centers of excellence, we've introduced what's called digital expert. So during the time of the pandemic, what we were able to do would be to train customers remotely so that if we were unable to travel to those locations, we can guarantee that they have the right level of quality that they're obtaining from the technologist running the exams, whether that's in routine imaging or more advanced imaging. So a lot of the things that we've been able to implement are because of the faster transformation into this digital space, unfortunately caused by the pandemic, but it has also accelerated the opportunity that things like artificial intelligence can offer. So looking at things like artificial intelligence and reconstruction of the imaging, an MRI, for example, what's the advantage of this is we can reduce our examination times, thereby addressing further speed in the exams so that we can scan more of those patients that might be waiting for the tests. Also, the quality of the exam, because we can remove the noise from the exam, it makes it easier for the physicians to read those cases, thereby reaching a faster diagnostics. So beyond just the AI for better delineation of the disease by doing the region of interest or heat maps, we can also make it simpler for the radiologist to see the images and triage those images for the ones that are the most critical to be diagnosed. So I think there's a lot of opportunity that this short-term impacts have delivered to help us move faster to the long-term gains of what digitization can deliver.
I guess I'm going to move now to Saha and hear a little bit more from Saif, because a lot of the examples you have mentioned have already been tried and tested at Saha, which also has been at the forefront of this battle, of this pandemic, transforming also a lot of solutions, automations and digital solutions to your healthcare system to elevate the standards, as we mentioned, for patients. The question to you is, how have you done it?
So, rightly said, the pandemic actually made us learn a lot and made us actually accelerate our digital transformation throughout the healthcare industry. Especially during the pandemic, we focused mainly on reducing the patient's visits to our medical facilities to reduce any repercussions for precautionary reasons to avoid transmitting the disease across different patients, and especially when you have high case or critical patients to avoid that from happening. So we actually used technology that was available today, and from a digital infrastructure, we were well prepared from this perspective. So having said that, we utilize video conferencing, for example, where patients do not have to come into any of our medical facilities and they can actually interact with our physicians. And using our current mobile app where the patient actually has access to his medical records and he can see his radiology images over there. And we actually do utilize that capability to have the patients interact with the physicians over a video conferencing tool. In addition, using our vast networks here in the Emirate of Abu Dhabi, using of Sahha, being one of the largest healthcare in the Emirate of Abu Dhabi, we utilized technology to where we know that certain patients have some medication refills where they can auto refill their medication, and we added the additional service of delivering those medications to their homes instead of having them leaving their homes and getting exposed to any sort of sicknesses. Using our partners in our cloud digital infrastructure, we got a lot of support. And one of the areas where we're touching base on is the tele-ICU. Whereas Sahha today, we have Center of Excellence with our partners, Mayo Clinic. We are actually going to see the capabilities through our digital infrastructure to monitor ICU patients across the Emirate of Abu Dhabi, so that we can always provide the proper healthcare needed and they're monitored around the clock. Another area that we've also explored with the partnership of DOH was remote monitoring wearables that we've actually used a couple during this pandemic, but it's not limited to the pandemic. We actually were looking into it prior to the pandemic, which was monitoring patients post-surgery, patients with long-term sicknesses, so that we continue monitoring them proactively and the physicians can see their health vital signs accordingly and advise whether or not to get involved immediately or send them an ambulance, so that we're proactive. And this has been accepted by the community, and they were actually really impressed. And this is the care that we're looking at here in Sahha. We've split it up in 3 different areas. One, mainly the patient care. Second is providing the digital services and technologies to our physicians to better improve their medical caregiving. And the organization, from an organization perspective, in seeing how we can do our operations in a much better and sophisticated way. So it hasn't been easy, but definitely this has accelerated due to the pandemic. People have become more accepting from a physical or physician's perspective and nursing perspective, and that's actually helped us in that area.
Well, I can confess I've used the Sahha app quite religiously, certainly in the early days when I found myself needing a PCR and not knowing where to go. I have used the app, and it has saved us quite some time in finding location, booking an appointment, getting a PCR and getting the result done. So that was pretty seamless for that. Let me get into a little bit more into artificial intelligence. You've all mentioned it. There's no disagreement about its value and impact on the patient. Let me take that to Mazen. We all heard a lot of different results and examples. I'd like to know a little bit more from you. How do you think AI is empowering the healthcare givers to curate personalized care for patients, care plans, adapting evidence-based practice, predicting disease courses, and much more, taking basically this healthcare or patient experience to the next level?
So the word empowering is very powerful, I think, in your question. And if you look at how can healthcare providers take advantage of artificial intelligence in disrupting healthcare, number one is, as mentioned by Mr. Ahmed Yahya, the involvement of the clinical leadership. So this is not an IT clinically led initiative. And that's why when you use AI, you are actually, number one, impacting and accelerating the process of decision making, right? And this is the key aspect of what would be some of the outcome that AI will drive: improved decision making. This will rise the concept of minimum data sets. What is the minimum amount of data that you can hand over to our clinical champions to make the right decision when it comes to the patient care? And this also asks the same question about the data integrity. Artificial intelligence algorithm requires data to work on. And if you are able to improve the quality of your data and make sure that your data that has been aggregated and fed into your algorithm is robust, you will be able to reach accuracy, high accuracy, as the examples that has been mentioned by the speakers prior to me, specifically in the radiology field. So what you can see, the word empowerment is very powerful. So the healthcare providers now are embedding with their technology partners the use of AI across the workflow of the patient journey, number one. Number two, you are able to reach very effective and efficient decision-making outcomes with the use of clean and high-quality data. Number three, you are raising the competency and the skills of those who are developing the algorithm and those who are involved in driving the production of AI solutions in order to reach a clinical valuable outcome. And number four, you're also able to embed these AI algorithms in the process of the workflow of the patient journey. So you're taking the patient journey, you are creating a care coordination environment where you are assembling and analyzing all the data inputs from all the different stakeholders that touch upon the patient journey during the journey in order for you to design, develop, drive these clinical AI-driven algorithms. So again, some of the thoughts that comes to mind if you look at it from a skilling and competency perspective to decision-making to care coordination and integrating the different silos within the clinical process.
Fair enough. I'd like to focus a little bit more with you, Ahmed, on this patient-centric healthcare delivery. There's a lot of focus on it by healthcare providers. Why is this the case now, in your opinion? And how do you think that's beneficial for both the customer and the healthcare provider?
As I mentioned, the last year and a half has been a breakthrough for technology. And in general, on the clinical landscape, IT has not been, I'd say, an easy sell to the clinical folks. But in the advent of this pandemic, a lot of the clinical team have seen the value of technology and how it made us get through this hard time the last year and a half. Whether it has sustained us as a business, sustained us as healthcare systems, as countries, and what have you. So what that happened also is it really opened up an acceptance culture that they do want to adopt new technologies. They do want to have technology embedded in the patient care itself. And like I mentioned, technology becomes more of like a nervous system to your organization. And the more you go above and beyond your boundaries of your organization, which is our healthcare institution, it goes beyond being at home with the patient. So there's a lot of data points that actually you would need to pull in. Now, the question becomes is how structured is that data? How do you tie these data points where to make sense? You need to look at the data in a macro level. And there's so much potential in actually building different logic and models here, clinically driven, if you will, and business driven. So there's a lot of automation also happening on the back of the office that will relieve a lot of the expenses that organizations actually are bearing to provide more specialized care to patients as we go on. So it's a different ecosystem that has emerged in the last year and a half, 2 years, that I see it being harnessed, and it'll actually move us forward in a totally different path. What was valid before was good for that purpose, but it's not, it could be valid now, but it's not ready for the future. But you do need to be ready. You do need to have an open mind to how do we move forward as an ecosystem in healthcare to reduce our cost.
I could see Saif shaking his head, nodding his head when you mentioned how IT has not been an easy sell when it comes to patient and healthcare sector. I'm going to ask you a little bit about that if we get some time, Saif. But let me ask you, Dr. Hatem, on a practical level, how have you transformed your facilities that are well equipped to provide accurate diagnosis, measurements, and basically executing what you just mentioned?
Hey, let me make another example for this in practice. For example, I'll talk about the application of the deep learning in the MRI. MRI is one of the examination which is many of the patients are claustrophobic because it takes long time for examination, and yeah, and everybody is looking for the open MRI with low magnet amplitude. So we are talking about the highest magnitude in the market, 3 Tesla MRI. Usually it takes, for example, an examination of the cervical spine, 30 to 45 minutes. Now, with application of deep learning and the air recon done in this machine, we can reach examination in 7 minutes only, which it's a great progress in getting the very high quality images with a very short time, so the patient can tolerate it with this application. This is one of the unique, I believe, step in MRI, application MRI, and this helped the patient. The second part is the teleradiology part, where we can report the cases remotely by expert subspecialty radiologist anywhere all over the world. We can ask for a neuroradiologist working in the USA, in Canada, and Europe, give us the idea and write the report. With this definitely will improve the quality of the report. We are keeping our KPI, the key performance indicator, including the turnaround time in cases of stat patients, emergency cases, urgent cases, routine cases. So by this, we find that we can reduce the number of radiology. So business-wise, if we are talking, the number is reduced, and the time consumption for the workflow of patient flow from the when we have his appointment till he has received the report dramatically decreased. And there are other KPIs which related to the patient satisfaction, how to measure the patient satisfaction. These are all the parameters which we can see online, and immediately how many patients are waiting in this area, so we can move patients from this modality to another modality within the same hospital, or to another hospital, nearby hospital, so that all of this related to the quality improvement in terms of the outcome and the improvement of the service of the patient.
That's definitely saving 60%, cutting over 60% of time and resources as well. Mark, I'd like to ask you a little bit more about what Professor Ghanem was mentioning, specifically on robotics, telemedicine, precision medicine, enabling healthcare providers to deliver effective personalized care. Give us a little bit more insight on this.
Sure. So when we talk about precision medicine, I think we also have to include into that the personalized part. And the combination of what we've just been discussing around artificial intelligence. Well, first we should actually start with, there needs to be a healthcare standard. So we're in October, it's Breast Cancer Awareness Month. And as our radiologist colleagues and clinicians understand, this is very well understood when we talk about things like BI-RADS. So BI-RADS is a criteria scoring system to look at malignancy versus non-malignancy. So we have to, and from this, you start to build your protocols to address the understanding and alignment. Now, one of the challenges that we have is making sure that we have a tailored care specific to that specific etiology, genetic, as well as other related items to that specific patient. So we need all the background information. So we need to have the data management in a precise way. Along with that data management, that data management can be prior experiences, the genetic aspect, different medications, all these things that come into play during your lifetime that may also be very useful when we start to look at AI and large amounts of data that we have in the healthcare system that are currently most likely not well understood and integrated into a final view. So once we have this information, we can have an enriched database from that specific patient and applying then artificial intelligence to help us. Now, why is that important? When we think about treatments, and if we take these diseases, focal therapies become more and more critical. One, because we want to salvage and keep tissues the healthy tissues safe. And in the case of some of the diseases, we start to do hyperfractionation from a therapeutic. So the radiation therapies, for example, we want to do more radiation dose to kill the disease without damaging the other parts. So AI has several points in this. First of all, it can categorize the type of tissue that you're looking to either focally treat through robotic surgery or ablation, different types of radiation therapies. It also gives us the ability with AI to spatially localize as well as tissue localization of that area so that we can address that in the right way. So artificial intelligence, I believe, is going to really help us as we move from improving our diagnostic accuracies, in the case that I mentioned, the breast cancer. It can also help us to focally localize and treat without damaging other important tissue. Maybe we go to next month when it's Men's Awareness Month for prostate, where you want to be very careful not to cut, if you're doing a prostatectomy, removing the prostate from disease. You want to be careful not to cut the nerves because it has many negative effects for that male patient. And so being able to robotically address that or focally therapeutically treat that, it's critical for us to have good understanding of that disease and its location. So the precision part of this is a combination of knowledge that we have because of our standards. We built BI-RADS for breast, PI-RADS for the prostate, along with the good clinical understanding of the disease, good AI utilization to better characterize the location, and then also control the treatment as focally as we can. So making it as minimum to impact normal tissue. So I think the combination is really an exciting and great opportunity for us to advance the care as well as improve the clinical outcomes.
Right, Saif, I have so many questions to you specifically on the challenges, but I'm sort of running a little bit out of time. So I'm going to mix two together and see where it gets me. I know you've went through some challenges when it comes to mitigating two things, inefficiencies as well as productivity challenges. And basically, how were you able to solve these challenges using digital tools to improve the digital infrastructure as a whole at Sahha?
So I wouldn't call them inefficiencies. It's more of the areas of pain that we have. And this pandemic has made a lot of our clinical staff and the IT staff and the administrative staff to work together in finding solutions that better improve our capabilities. One and foremost, the most technology that we've utilized or took advantage of was RPA, which is robotics process automation. And automation has seriously helped this organization in a lot of ways. One of the areas that we've focused on was as a pilot to see the actual technology working was with our revenue cycle team, where we've automated the claim submissions with our health insurance. And that has proven and given back to the organization miraculous numbers and information and submissions to the information to the insurance company. Another area that we're focusing on right now is, for example, going back to what Mr. Ahmed said was the patient-centered capabilities. We call it actually the patient journey. What we're doing is we're utilizing the RPA to, prior knowing the patients coming in for visits with booked appointments, where they can self-register themselves instead of actually sitting in a waiting area, waiting for their turn to go into the registration desk. We're automating that whole process through a kiosk, and at the back end, we're actually doing the eligibility check with the health insurance company to make sure that they have the eligibility to see this physician. So at the end, and this whole process we're looking at, it's going to take 2 to 3 minutes. And then the patient will be just waiting to be triaged and then go see the physician himself. So that actually helps the organization and reutilizes the resources that we have at the registration desks to do other capabilities, in addition, reducing the waiting times on the patients. Another area that we're really considering, which is proven, which is the AI radiology. And I believe my colleagues here on this call talked a lot about it. One, it's reduced the AI in the radiology has come years where it was before. And we're actually looking at also the robotics and the processing of it to help improve the imaging studies done by the radiologists down to minutes. And I believe the good doctor said around 7 minutes. In addition, we're adding to it the documentation. So all the physician has to do is he knows where to look at and read the documentation prepared by the robot to just approve or go to the next one. And that actually helps in seeing more radiology images, and that means seeing more patients and getting clearer and faster treatment for the patients. To answer the second part of your question, the digital infrastructure and digital transformation helps us work easily. This technology, the investment that Sahha is doing in this area, specifically in Sahha, because I speak on behalf of them, allows us to work with the Azures, the Oracles, the GEs, the Philips, using the capabilities available today. And it's not the capabilities available today, and it's not. It actually helps the organization in the economies of scale.
So I said it.
No, because definitely they're all partners. We don't favor others over people over others, but definitely we're all working to improving the healthcare overall. That's our main goals, and with our partners, we'll reach to our goals, inshallah. And we're actually we 2 years before the years before the pandemic, we were actually working with GE, looking at our e-command center and seeing the capabilities of actually improving our operations within our hospitals. And we were also looking at the digital twin for such cases of a catastrophe happening, how we can easily manage and operate our healthcare facilities within the Sahha organization.
Yeah, definitely. There's a lot of layers and work to be done. And since you said, since you mentioned the interesting note about the center, I was told to leave, the best to the last. I know you have a lot of information, Jeff, to share with us. That's why I tried to give you as much time as I can for you to give us an insight. Now that you've heard from physicians, from basically executives as well, regarding challenges and solutions that they have adopted. From your perspective, how do you think you're assisting these organizations and supporting them in these challenges, specifically in this region when it comes to digital solutions and services?
Absolutely. Well, I enjoyed the discussion, and I think these comments about having, it's not an IT initiative. It's about how do we make life easier for the clinicians? How do we get the AI, make sure the data is high fidelity, and then get it at the fingertips of the care team? I mean, just to share a couple of pictures to bring these ideas to life. We've had the opportunity in the region to serve the Dubai Health Authority with their command center and the Saudi Ministry of Health with their National Health Command Center. But if we take a step back, what is that work? At the end of the day, when we say command center, GE, we mean software that helps care teams in the core, and this is a quote from one of the nurses we serve, to fight and win the daily patient care battle. It's intense every day, patients, information, and how do we, sort of clear the fog of war and get the right information to the right caregiver about the right care patient at the right moment. That's what we mean by command center. We do that because when we do it well, it saves people a lot of time. It improves flow, unify teams. At the front line, it's all about time, right? And getting the teams to work together. At the organization, that means saving a lot of money, improving quality, improving revenue, things like that. And there's an important point in here that this kind of software that GE brings, this optimization software, people call it level 2 software. that builds on level 1 software. And just to unpack that a bit, when we say level 1 software, we mean all the workflow systems like the radiology information system and the OR information system and the ED information system and the orders system and business intelligence systems. And what we're doing with Command Center software is building on top of that a system that does ingest all the data and harmonizes it and does new things with it. And the reason that's so important is because all those level 1 systems tend to be siloed. So the RIS may know something or the ED system may know something, but those are siloed and it's very difficult to connect the dots, and therefore we can miss the big picture for the patient. Who should go next? What treatment should the patient get? 1,000 things. And so that's what we're doing now. And I love to put some pictures in here because, and by the way, we'll be working on this for 20 years, but these are real pictures of these tools in use today in multidisciplinary rounds, right? That's the heart of the care teams. That's the mechanism where all the functions come together once or twice a day. And that's where they're using our software to see the whole picture. Using our software for things like how do we find patients to downgrade? This is in the hallway of an ICU, an APP, a case manager, a bedside nurse. And here in a central center, using an optimization app to figure out what patient should I place next into which bed out of the thousands of patients and the hundreds of beds, and then performing those actions in other systems. But the AI coming forward here on this screen here. So what's the impact of doing all these things? Well, it aligns with what the panels talked about. And you can see these have been documented at the organizations mentioned. The first one is to save time, reduce mouse clicks. We found one user, we were saving that user more than 2,000-3,000 clicks twice a day. And then you get into the more operational things, transfer acceptance, balancing utilization between hospitals, reducing length of stay, creating virtual beds. And then as these tools get further and further into the heart of the operation, we see these quality impacts, reducing the number of babies that go to the NICU, reducing how often we have to use restraints for patients with behavioral health issues, reducing code blues where we have to resuscitate a patient. So starts with saving time, but when you save clinicians time, you get throughput and quality benefits, of course. So this is a list I'd let your audience might like. These are the names of our apps, but these will mean something to people. Apps around lines and drains and perinatal and observation and downgrade, surgical growth, procedural growth. These are very modern apps that come forward to put AI at the fingertips in the way people have talked about. What AI specifically are we doing? Well, we're predicting when's every patient ready to leave the ICU? Where does a patient have a lab that has a negative result, but the medicine that's been prescribed doesn't match that? It's contraindicated. All sorts of things that we continue to work on. And we'll be working on another 100 more for years to come. I think the big next step in the region, the work that we've done so far is mostly around dashboards, which dashboards are important, but they tend to be static and looking backward. What we're starting to see and what Saha is doing and what the panelists have shared is getting to more real time. So instead of looking at what happened, looking at what's happening now, like a GPS to say, what should I do next? And I think that's the big next step for the providers in the region that we're seeing. So again, just to close, I'll just say the work that we're doing is about getting the data together, getting the AI together, but in the end, putting it at the fingertips of caregivers so that they don't have to click around, so they don't have to dig, so they don't have to wonder, so that all that's processed and right in front of them. By the way, the human is still the most valuable thing. The human makes the decision, but when we can make it easy for them, we save time, we save money, we get better outcomes. And that's what we mean by Command Center.
Perfect. There's a lot of information. I know there's no way we can cover all these improvements that you are doing and using technology to improve patient care and improve the patient journey. We'll take several webinars, maybe a series. But with that, gentlemen, I'd like to thank you so much for being part of this Forbes Middle East webinar discussing digital healthcare, basically transforming tomorrow. Thank you so much for joining us, and I hope we'll continue this discussion in future webinars. Good luck to all of you and to a better healthcare journey and healthcare sector globally and in the region. Thank you so much.